For OSCE, the main goal is, again, doing the bare minimum, doing the standards of practice, making sure that you know what you're supposed to do. So it doesn't really require you to explain literally everything you need to do. You just have to pretend that this person is a paying client, right? So if you're gonna do an effleurage, you're not gonna be telling this client, hey, I'm just gonna put oil in my hand, rub the oil, massage the thing. Unlike school, because in school they want you to keep saying these things. In OSCE, you just do. Talk less, do more, yes. At school, the point is, we need to know if you know the basics, the theory. Right. That's how school works. For OSCE, they test you on application, right? The actual fact that can you be left alone massaging someone. Just imagine, like if you go to a massage and I'm your massage therapist and I tell you, Alexis, I'm gonna start putting oil in your body. And then, okay, now I'm lather. It's annoying, right? However, there are some things that you need to explain a bit. So for example, I found a trigger point here at the back. Yeah?
Yes.
Definitely I have to explain, hey, client, I did find a trigger point around this area. I'm going to treat it with trigger point techniques. And this will be a little bit painful, so on, yada, yada, yada. Why? Because it's an instruction about what they're supposed to do. So that I would say you can talk. But then in terms of general Swedish techniques and other things, I don't think it is that relevant. The aim of OSCE is to make sure that you create a safe and effective treatment. If we imagine, if you're talking too much, would that make a difference in making it safe and effective? Not really. So you don't have to talk. Talk less, do more. That's why the stems are very, very much specific. The stems are too specific to the fact that whatever they say, you do.
But what about in the treatment one where I choose my techniques?
That one is application. So in that, when we go along on that station, when I'm going to teach you, they are testing you on one thing. Can you figure out something if a client presents you with a condition? So what they're going to be checking is, are the techniques that you provided matches the problem? Like for example, there is no swelling, but you did manual lymphatic drainage. Does it make sense? No. Right? Because what's the indication of using manual lymphatic drainage? Swelling. So if you did that in a treatment that doesn't require it, probably you're gonna get a mark off, right? If they said the patient is experiencing lower back fascial restriction and you did myofascial technique or fascial technique, you did the proper steps from step 1 to step 10. You figured it out. Doesn't matter how many steps there is. And you fixed the problem. Does it match the condition? Yes, it is. So that's the logic of the treatment station. To figure out whether the area that you're treating will be fixed or will be treated using the appropriate technique that you picked. However, for techniques, they are testing if you know how to perform it. This is gonna be, the way to figure this out is it has to be organized. Because for you to make sure that you're spot on this and you're gonna be graded well, you have to prove to them that when you do each technique, it's precise. Cross body. Some people, they say, oh, you cannot go cross body. You can. You can.
Cross body frictions?
No. Like for example, right now I'm on the right side and I want to do something on the left. You can do that. Doesn't matter. So for example, the problem is lower back and it's on the right side. You can touch a little bit of the left, but focus on the right.
Okay.
Right? Like, whatever you feel is needed to be fixed. So, like what I said, the stem is literal. If they said lower back, then lower back. Another thing, if you made a mistake in draping, don't panic. Just redo it. If you made a mistake at any point of time, just say, let me redo it. Then redo it.
Yeah, okay.
Okay? The point is safe and effective treatment. So, if you were treating, for example, and the drape is exposing someone and you keep treating, that's not safe because you expose them. Yeah. So if you notice that, maybe while you're doing a petrissage or something, and then you notice that a little bit of the underwear is being shown, then fix it. take your time to fix it. Safe and effective, right? And then obviously client care, asking them if for stretches or strengthening, do you feel the stretch? Do you feel the tension? Do you have pain? Do you feel discomfort? How are you feeling? Those are the questions that you can ask.
Yeah.
Okay? I mean, you can ask anything that you need per se, but again, do not overthink it. Whatever is in the STEM is whatever they're gonna test. There's no extra things that they wanna see. You don't need to justify everything. That's why it's very specific. And obviously, you need to sanitize your hands. So, for example, I have here a sanitizer.
Yeah, so it's not washing hands, you're just sanitizing in every station, or?
I'm just sanitizing in every station. So, for example, here I'm just sanitizing. So, you don't have to be like, because some of the students are asking me, hey, can I show them I have to sanitize for 10 seconds? You don't have to count in front of them. Just literally enter the room. You don't even have to say hi. And then just lather your hand as long as you can. You know, like, not pretend, but literally just, you know, while you're reading, sanitize. That's it. You don't have to be like 1, 2, 3. Because there are some students who does that. You don't need to do that. For example, you got stuck. You got stuck and you're like, oh my God, can I go back and read the STEM? Sure you can. Just go back and read the STEM and maybe sanitize on the way while you're in.
No matter what order we perform the technique.
If it's logical that if they tell you, you can do it in any order, then do it in any order. But if they tell you if they give you a scenario based, you know that it has to be in a specific order, right? For you to create something like in assessment, even in treatment. Like the unspoken rules of like principles of massage, for example. I saw in one of your questions that you were like, what would I say? I'm a massage therapy student or candidate. Make it easy. Just say, I'm gonna be working with you today.
Yeah.
Yeah, you don't.
Okay.
Yeah, just say, hi, I'm Steph. I'm gonna be working with you today. So we're gonna start with. That's it. Remember, in health history, this is the first time you're gonna meet the client. So even if they know that your name is Alexis, for example, you still have in station 2, you still have to introduce yourself because in real life, that's when you introduce people. But on assessment 2, you don't have to say, hey, because you technically you met them already. So that's why it removes your stress. You know, you don't have to keep saying it. The only time that you're gonna say it is health history.
Okay.
For example, you're in station 2. Hey, my name is Alexis. We're gonna do health history intake form, and I'm gonna be working with you today. So let us start. Then you can do your spiel, whatever it is. Got it? So for the technique station, the point is number 1. To ensure that you know each steps of each technique. You don't need principles of massage here unless it's a part of the bigger technique like trigger points, fascia, friction, those things. But if they tell you beating tapotement on upper back, then do beating tapotement on upper back. So you don't have to do any extra thing. Again, whatever they say, you do. So for you to practice for this, it is important that you know each step of the technique. Okay? If you have the habit of naming the technique, sure, but again, do not over-explain. Okay? So let's do the review of the basics first. So now I'm gonna show the demo's body. So I have here a massage therapy guide, right? Gonna be sending this to you at the end. Everything that you need from, interview, assessment, range of motion, gait, everything that you need will be here, including a checklist of how to perform specific techniques. And all of these are from the resources provided in the Prometric Handbook.